Hi friends, Dr. Christine here. Today I want to tell you about the 9 telltale symptoms of depression. Many people who may be suffering from depression show different symptoms. We are all different people, so sometimes it can be very easy to overlook these symptoms and not be able to help oneself or others who are suffering from depression. Now, here are some common examples of symptoms that may be associated with depression. The first one is prolonged period of sadness or just not feeling up to it, usually more than 2 weeks. Those are people that are never feeling like they're in the mood, who'd rather mope around the house, lay around the Chesterfield and feel sorry for themselves. They could be depressed. People who are wanting or planning to take one's life. Now that is more serious. If you or a loved one feels like that, it's called suicidal. If people around you or yourself are talking about death as something you long for, that you want, talking about wanting to die, especially if you or your loved one already decided on how to do so, it is time to immediately call for help, please. And if urgent, if you have a plan or they have a plan, take yourself or your loved one to the nearest emergency room and let the triage nurse know what is happening. Now, another sign of depression is feeling hopeless. The classical perennial pessimist, they're always pessimistic. Mostly they feel sorry for themselves, which is another common symptom for depression. When a person actually feels like he or she has nothing to look forward to in his or her life. Perennial pessimists are usually very negative about things. They also may feel as if they are the victim of circumstances that others are to blame for. Many people that feel depressed are guilt-driven. They feel worthless and helpless. Guilt, feelings of worthlessness and helplessness are other symptoms of depression that can often be seen in depressed people. Whenever a person feels very guilty about an event of the past that may not have been their fault, he or she may feel like they don't deserve to be happy. So the loss of self-worth that this person feels, like he or she isn't worthy of being happy or enjoying themselves. It is very depressing. Helplessness also can contribute to feeling depressed. If someone, I know that, feels trapped in a situation and helpless to get out of it, it can end up being in a depression. Number 5, loss of interest or pleasure. If someone is just dropping the hobbies as well as the other things that they used to enjoy and feel unable to find anything that can bring them enjoyment or pleasure, this can be one of the telltale signs of depression. This can also be due to a lack of meaning in life generally. And if that's the case, have a look at the book by my mentor, Viktor E. Frankl, Man's Search for Meaning. I love it. Another sign is fatigue. When somebody's always tired and the doctor can't physically find anything wrong with them. It can be just a lack of physical energy. And no wonder really, because if you've lost interest in life that you had before, why would you bother doing anything? And also their sleep can be disrupted, as can be the eating habits. Another common sign is trouble concentrating, bad memory, and having trouble making decisions. Most people suffering from depression have some of those signs of depression. It's related to the loss of interest in the outside world or anything else that matters to healthy people. They may lose track of things like dates, appointments, taking medications, even having a shower, and actually not be able to remember events that happened or what other people said. They may also seem to just not pay attention. Then there's changes in eating pattern or excess substance use. If you lose all interest in food, appetite, as well interest for others, and for other people, it is eating too much, especially junk food. It can be because you just have no enthusiasm for life, no more interest in eating something that you usually like. It can be a sign from depression. And actually, physiological changes in brain neurotransmitters can be corrected with certain foods or substances, not in a healthy way, but for a temporary fix. So it's a kind of self-medication. So by all means, pay attention to a sudden weight loss or weight gain in those around you and try to help them to figure out what may be going on. The same changes in sleep pattern can be a sign of depression. Some depressed people sleep too much. They just can't get out of bed and can stay in bed all day. And others sleep too little or wake up very early in the morning or all days of the night. If that happens not just once, it happens to all of us sometimes, but all the time, especially more than 2 weeks, find out what's going on and maybe causing the sleep issue. And sometimes it can help to start with easy things in your sleep surrounding. You can find that in my tip sheet, top 10 sleep hacks, like having a cold bedroom, quiet and dark in your bedroom, and simple things like that. Other possible symptoms that some people have that feel depressed is that they can be restless, can't sit still. They may be irritable and have a short fuse. And some others have a physical symptoms with no clear cause, like chronic headaches, irritable bowel, or various body pains, especially when it's combined with anxiety, which is quite common. So when do you, as the affected individual or a family or friend, needs to take action? When is it? So if you or a loved one has one of the other symptoms above, and especially if there are several of them coming together and for more than 2 weeks, and certainly if it impairs you or your loved ones functioning, like not being able to work, not being able to have a shower, not being able to eat or clean up, it's time to seek help. Where do you find help? Number one, please see your family doctor. He's always the first to ask. You might consult a psychologist or psychiatrist. Those can be very helpful. If needed, call the local suicide helpline or go directly to the emergency room. And a specialized mental health coach like myself can also help. So if the latter is what you want to do, click below and I'd be happy to talk to you. Bye-bye.